Greetings, viewer. I trust that you're well, and welcome to Adolescent and Youth Sexual Reproductive Health, a show that bridges the knowledge and information gap regarding matters sexual reproductive health. So today we are joined on board by Pacis, and she's from Burundi, and she's going to share with us the work that she does on sexual reproductive health. So welcome to the studio, Pacis.
Thank you so much,
Hello, Pacis.
Violet.
Hi,
Hello. How are you?
I'm very well, thank you. Kindly introduce yourself to the viewer so that they can get to learn more about you.
Thank you so much, Violet. My name is Dr. Pacis-Alarine Irambona. I'm from Burundi. I'm the founder and also the executive director of a nonprofit organization based in Burundi called WeUp for Future. WUFF. It's an organization that work with young people and also with women. Yeah, and our motto says promoting the young generation. So we focalize more on the young generation, but we also work with women.
Oh, great. So kindly share with us the projects that you have implemented or are currently implementing on sexual reproductive health.
Yeah, thank you so much, Violet. Normally, our organization we started it have been initiated in 2019. It was around April 2019, and then it have been legally registered by the Burundian government on 15 June 2020. So it have been 6 months that we are working legally in our country. And when we initiated the organization, the only idea we had was regarding the issue of sexual and reproductive health. It's where we started our program called Period Normal Limitation, and the program have been initiated accordingly to what we were seeing in our communities. I'm working as a medical doctor in my country, and I've been realizing that we have a lot of issues regarding how sexuality is a very big stigma in our country and in our continent in general. So I had that on my heart, and I wanted to help adolescents, either girls or boys, on how they can handle their sexuality, and also the issue of hygiene menstruation. So that's how the idea of starting this organization started. And then when we were thinking about how to implement the organization, we realized that young people and women have a lot of issues. It's not only regarding the issue of sexual and reproductive health. So we enlarged the idea, and that's how we started the organization. But our main program concern the issue of sexual and reproductive health, and we work a lot with the young people, either in city or in rural area. So we focalize. We have a program that's called Period is Normal Limitation, as I've mentioned before, and what we do with our program is to teach the boys and girls, either those who are already experiencing their menstruation or not. We teach them. I mean, we have our outreach programs, and we call it it's in a French word we call sexualité sans tabou, so which means sexuality without stigma. So that's what we do, and we also focalize on teaching the young girls how they can make themselves their sanitary pads, because one thing is there is the issue of ignorance on how to handle the menstruation, and there are also the issue of having access to the sanitary pads, because most of our communities and most of our girls, they can't afford to buy the pad that someone can use and then throw. They can't even be able to buy the reusable one, the one they saw, because they are all very expensive for our population, like, regarding the income. So one of the things we do in our organization is we teach them how they can handle their sexuality, but we also teach them how they can sew or make themselves for themselves the sanitary pads. So this is one of the programs we are doing locally here, either in communities. So we have sometimes outreach programs, and we also have sometimes those programs, and we are so thankful because there are some churches that are very open to that. There are some churches that have opened their door for us so that we can go and teach the girls, the boys, or the women, or sometimes we have activities all together. So that's the program we have been doing. We have a program on that, and that's one of our main program in our organization.
All right, all right. So kindly share with us the partners that you are working with, or even the donors that you are working with, even as you carry out menstrual hygiene management.
Okay. As I've mentioned before, our organization have just been legalized like 6 months, 6 months ago. So we don't have yet. I mean, unofficial. I can say partners or donors that are official for these specific programs. So what we do, I mean, we have friends, we have people who really love organization. I mean, individual people who help us. Like last time we got 50 fabrics. It was given by an individual person who really, who really think that this issue of handling hygiene menstruation is on his heart. So we have just individual people who donate for this program. We are still seeking, we are still looking for partners or for donors, but for now we don't have yet any official partners. The partners we have, like, it's local administration, it's churches who allow us who open our door to us, because we have doctors in our organization, we have nurses, so we have people who volunteer themselves to go and teach, and then we have people who give us like fabrics, who give us scissors, things like that, to go and teach about those issues and teach the girls how they can handle it. Yeah, so I can just say for now we don't have any official partners or donors for our program.
All right. So kindly share with us, why did you decide that you are going to focus on menstrual hygiene management?
Uh, the idea came in 2019. We do a lot of outreach programs. So we go countryside a lot of time, and we discuss with the communities, we discuss with people who live there, and we realize that there is a need, and those people need, they need to be helped. The other thing is the rate of pregnancy that our Ministry of Education have registered. So it's awakened our spirit. And the other thing, there is a lot of organization in Burundi who are working on the issue of menstruation hygiene management, and we were just looking on the side that they focalize on, and we said we need to bring something new, something that even those people who have very, 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 very low income can beneficial can have, I mean, can get a benefit on it. Yeah, so that's how we started with this approach. We said we know anyone can't afford to buy sanitary pads, and we know each girl, he will go through like more than 30 years experience the menstruation. And then we said we need to sit down and see how can we help, what can we bring to the community that can help them. And the other thing is we had a lot of discussion with elder women who are living especially rural areas, and those women, they go through I mean they live their menstruation very years past, and they handle it very well. So what we do is like we approach these women and we ask them how they did it, what they did it. So maybe that we can be able to bring back what they were using but implement it on our, our current life. How can we help those young girls who say they don't have money to buy pads, without going to sleep with men, without going to, I mean, our program says one of the objective of our program is zero school dropouts, caused by the lack of sanitary pads, because we have been hearing a lot of girls who have been missing school and dropping school out because they don't have a sanitary pad. So that's one of our I can say that's one of our motto, because we focalize on education a lot, we focalize on leadership, we also focalize on education. So there is no way that we can promote development, we can promote leadership if we don't focalize on education. And one of the things that I always share with parents is, if you are sending your daughter to school, you can give him, material, you can give him books, you can give him everything. But if you don't give to your daughter a sanitary pad, there's something that is lacking in her education. So that's what we are doing, and that's where the ideas comes from.
All right. So the other question that I have for you is, does your country have a menstrual health policy document?
Yes, it does. It does, and currently, in most of the public school they have specific time for sexual and reproductive health education. I mean, it's not that enough. It's not that enough. I mean, it's not enough for students or for schoolgirls and boys to understand it all. But we have some policies, and we have some courses, and I mean we have some times during the school days or the school hours that they teach them about sexual and reproductive health. And we also have some other programs. The international organization that we have currently here in Burundi. There is a book that they made. It's a book in French that said "Le monde commence par moi," which means in English the word starts. It started by me. It's a book that have been done. For I mean to easy teachers, and to easy the way we can communicate all the things about sexuality and also reproduction to the students, especially those from primary and secondary school. So our government is really trying on, to implement it. But this is Africa, and talking about sexuality, it's a very big stigma in Africa, so it's not easy at all. But I think our government is trying to implement other things in our schools.
Great. I'd also like to ask, does your country have an adolescent and youth policy document on SRHR?
I'm not really sure about that. But what we have, I mean, I can say that it's a document apart. It's a world document. Yeah. So it's a world document. It's a world document. We have I mean, our Ministry of Health. We have a department. We have a department of sexual and reproduction. And I mean, it's a world thing. It's not like for girls, for adolescents only, but we have some sections that are specific for adolescent. But we have a world document on how the government is implementing the issue of sexual and reproductive health in schools, in communities, in churches, in administration, something like that. But it's a world document. I can say that it's a policy just for adolescent, but it's a world document. But we have sections for who are very specific for adolescents. Yeah.
All right. Share with us about your team. Yeah.
Okay. Our organization, we have 10 members, and they are all co-founders. So we have 9 plus me. So they are co-founders with me within the organization. And we have specific people who who do the outreach programs. So there is me, who I'm a medical doctor, and then we have a nurse. We also have a medical student who is with us, and we also have other people who are doing the logistics stuff. And what we do, it depends. Sometimes we do the outreach programs in cities, sometimes we go countryside, and also sometimes we recruit volunteers. Yeah, so but most of the time, because I said we don't have partners, we don't have donors, so we don't have, all the program we do, all the activities we do, we give ourselves. So we volunteer, we do it with our own finances. So what we do most of the time, we can't go all of us when we do the outreach programs. We have set us like a model for the work we do. Depending on what we are going to teach and on who. Sometimes we have program with 5 to 10 years. We have 10 to 15 years. Sometimes we have our work with only boys. Sometimes with only girls. Sometimes girls and boys together. Sometimes we have girls and women. So it all depends. It all depends who to go with, who to recruit as volunteers. So that's what we have been doing. But there is a program that we are about to launch, and the program is it will be about to teach communities workers how they can how to sew the sanitary pads, and so they can go and teach. So we will keep them with materials, because as I've said, we already have the materials who are made 100% cotton. We have scissors. We also have other logistic stuff that we'll be using. And then I think we will launch the activities beginning of January, or at the end of January. So we launch the program, and we have a lot of people who are working with us, but most of them, they are just volunteering to come and help. But at the same time, we are also working with other organizations, other local NGOs here who are working on the issue of sexual and reproductive health.
All right. So I'd like right now we are coming to the end of the broadcast. So I'd like you to pitch to a potential donor who is watching this show, and tell them why they should support your organization.
I think one of the things that I can pitch on our vision, our organization and vision to create an equitable, a healthier space where the young generation and women are educated and empowered. Our only aim is to promote the young generation, and there is we can talk about promoting the young generation if you're not promoting the health, if you're not promoting the menstruation hygienic for girls. One of the things that I like to say is, if we are willing to see women leaders in 20 years, in 25 years, we need to promote their education. And for me, you can say that you are promoting a girl education if you are not also promoting her hygiene menstruation, because it's a part of her life. We be living with it more than 30 years. So one of the things that I can share with donors is we are very accountable. We are very humble people. We are, we are really working with our communities, and everything that we do, it's for the community. So we're not doing it for ourselves. And also, I can also maybe invite them to visit our page. We have a Facebook page. We have a website. Maybe we share it on your page if you allow us to, after the broadcast. And I think it's a good opportunity. According to what we have just done in 6 months, I think we are accountable. We are very accountable, to welcome any donors who really want to invest in this program. So for now, we just have individual people who invest in our program, and we are so thankful for everyone who have been giving his means for this program and to contribute. We have a lot of testimonies to share with our donors. We have a lot of outcome and result that we have been collecting with people that we are helping. So we are very open to anyone who wants to invest in this program.
All right. So thank you, Pacis, for gracing the show, and we wish you the best of luck, as well as your team, even as you continue empowering adolescents and youth in Burundi. So, viewer, we've come to the end of this show, and we want to say thank you for joining us. And we're looking forward to seeing you again, even as we host our next guest. Asante. Asante in English means thank you. All right.